Welcome to the deep dive. Today we're unpacking a vital system that, well, often works completely silently, no drama, no immediate pain. We're talking about your kidneys. And specifically, we've dug into recent research and notes to decode 5 quiet signs that your kidney function might be slipping, sometimes years before you'd expect.
Exactly. And our mission here is to give you a kind of shortcut to being proactive. We're really drilling down into the most important things, what signs to watch for, and the immediate habits you can change. Food, hydration, movement, things that can help stabilize function. The goal is knowledge, so you can have informed, data-driven conversations with your doctor, not self-diagnosing or hitting panic mode.
Absolutely. Informed, not alarmed. That's key. But before we get into those subtle signs, we really have to stress safety. If you have severe sudden symptoms like intense pain in your side, what they call flank pain, or visible blood in your urine, sudden major swelling, trouble breathing, chest pain that's different, that needs urgent medical attention right away. What we're covering today is educational. It's about long-term awareness and protection.
Let's talk about who really needs to lean in and listen closely. If you have certain risk factors, what we sometimes call the big 4, pay attention. That means diagnosed diabetes, high blood pressure, known heart disease, or a strong family history of kidney problems. Your risk also goes up quite a bit if you're over 60, or if you regularly take high doses of NSAIDs, things like ibuprofen.
Okay, so if you fall into one of those groups, or if you start noticing any of the subtle signs we're about to discuss repeatedly, you need the right information. Just getting standard yearly blood work might not be enough, right? What specific tests should you actually ask your provider for?
Good question. You really want to ask for 3 key things. First, a serum creatinine test. That lets the lab calculate your eGFR, your estimated glomerular filtration rate, basically how well your kidneys are filtering. But honestly, the real game changer for catching problems early, it's the urine albumin to creatinine ratio, the ACR test.
Okay, why is that ACR test so much more powerful than just the creatinine level? A lot of standard panels include creatinine.
Because creatinine tells you more about current filtering capacity. The ACR test detects the leak. It finds tiny amounts of protein, usually albumin, that are slipping through kidney filters when they're stressed. And it often finds this long before the creatinine level looks off or the GFR starts to drop significantly. So that ACR result, combined with tracking your blood pressure consistently at home, that's the data that truly empowers you.
Got it. Data is power here. Okay, let's break down these 5 silent signs. Starting with one you might actually see in the toilet bowl.
Right. Sign number 1. Foamy or persistently bubbly urine.
Okay, but wait, doesn't everyone get bubbles sometimes? Especially, depending on how forcefully you go or if there's cleaner in the bowl. How do you tell the difference?
That's the key. It's about persistence. Normal bubbles pop pretty quickly, dissipate. If the phone hangs around looks almost like the head on a beer and it's there consistently, especially first thing in the morning, that's the red flag. It usually means protein is leaking out. Those kidney filters are supposed to keep protein in your blood.
So the instinct to just chug a ton of water to flush it out is actually the wrong move.
That's a classic mistake, yeah. Don't force gallons of water. It won't fix the underlying leak, and it can actually put extra strain on your system. Instead, the immediate action is dietary. Focus on lowering sodium. Maybe swap out processed meats like bacon or sausage for cleaner proteins. Think beans, lentils, tofu, and a really quick kitchen win. Season food with things like herbs, lemon juice, vinegar, high flavor, low sodium stuff, instead of relying on salty sauces or salt shakers.
Okay, that makes sense. If protein leaking out is one sign, another related one people often dismiss is swelling. How is kidney-related edema different?
Yeah, that's another crucial distinction. We're not talking about temporary soreness. We're talking about persistent swelling, edema, usually in the ankles and feet. Sometimes it shows up as puffiness around your eyes, especially when you first wake up. It's a classic sign the kidneys are struggling to balance salt and water. When they can't keep up, you retain both fluid and sodium, and it often gets noticeably worse after a particularly salty meal.
And here's where that common myth comes in. People thinking fancy salts like sea salt or pink Himalayan salt are somehow healthier.
Oh, we absolutely need to shut that down. Sea salt, pink salt, any salt is not better for your blood pressure or your kidneys than regular table salt. Sodium is sodium. The source doesn't matter in this context. To check for this kind of swelling, you can do the pitting edema test. Press firmly on your shin bone for a few seconds. If it leaves an indentation that stays for a bit, that's pitting, and it's a data point to mention to your doctor. Also, notice big swings in your weight from morning to evening on the scale. That can indicate fluid retention.
So what's a fast kitchen adjustment to help manage this fluid balance issue?
Rinse canned goods every time. Canned beans, vegetables, lentils, rinse them under running water. It washes away a surprising amount of sodium. And look at your condiments. Swap out high-sodium soy sauce for something like coconut aminos or reduced sodium tamari. Getting a handle on sodium is key for fluid balance.
All right, let's move to the less visible signs. The internal ones people often just blame on aging or stress. Sign 3, persistent fatigue, brain fog, maybe finding exercise harder.
Yeah, this one's a bit complex because it can happen for a few reasons. First, if your kidneys aren't filtering waste products efficiently, those toxins build up and can cause that general lousy feeling, the fatigue, the brain fog. Second, kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells. If kidney function declines, you might make less, leading to anemia, and anemia definitely causes fatigue. And third, something called nocturia, having to wake up frequently at night to urinate. That just wrecks your sleep quality, contributing to daytime fatigue.
So if you're feeling chronically exhausted, it's not just about kidney labs. What else should you maybe ask your doctor to check?
Ask for a complete blood count, or CBC, to check for anemia. Also worth checking are ferritin levels, iron stores, B12, and vitamin D. Deficiencies in any of those can contribute significantly to fatigue. And in terms of response, think about how you eat protein. Try spacing it out more evenly across your meals instead of having one huge protein load at dinner. That can ease the filtering burden.
And you mentioned a plate structure for better energy.
Yeah, a simple guideline is the balanced plate. Aim for about half your plate to be non-starchy vegetables, a quarter whole grains, and a quarter lean protein. This helps provide steady energy release.
Okay, sign 4. This one's huge. High blood pressure that seems to be creeping up or is hard to control. You called this a catch-22.
It really is. It's both a major cause of kidney damage and a consequence of it. It's a truly vicious cycle. Your kidneys play a massive role in regulating blood pressure through hormones and fluid balance. When they're stressed or damaged, they can't regulate as well, so pressure tends to rise. But then, that higher pressure pounds away at the tiny, delicate blood vessels within the kidneys themselves, causing more damage. They literally harm each other.
So when we talk about catching this, relying only on the blood pressure reading you get at the doctor's office isn't enough. Why the push for home monitoring?
Well, the white coat effect, where pressure is higher at the doctor's, is definitely real for some people. But it's more than that. It's about getting consistent, accurate readings over time. You really need to check your blood pressure at home, ideally twice a day, following the proper technique. Sitting quietly for 5 minutes first, feet flat on the floor, back supported, arm resting at heart level. And critically, using a validated cuff that fits your arm correctly. A cuff that's too small or too large will give you inaccurate numbers. Garbage data, basically. A study suggests just relying on office readings misses a lot of hidden high blood pressure.
Okay, so you get a good home monitor, you're tracking accurately. What's the lifestyle response to rising BP?
It's really about adopting a pattern like the DASH diet. Dietary approaches to stop hypertension. Lots of fruits, vegetables, whole grains, lean proteins, low-fat dairy, and critically, getting regular physical activity. Aim for about 150 minutes per week of moderate exercise, like brisk walking. A quick win. Swap salty snacks like chips or pretzels for unsalted nuts, seeds, or maybe some yogurt. And that 10-minute walk after meals we'll talk more about, huge impact.
Yeah, that post-meal walk keeps coming up. Okay, sign 5. Changes in urination itself, like frequency, needing to go at night, or the urine looking different.
Right. Changes here can mean a few things. Maybe the kidneys are having trouble concentrating urine effectively, so you go more often or have paler urine. Or it could signal dehydration if it's consistently dark. Or, worryingly, it could indicate blood. And that nighttime waking nocturia is super common. If you snore heavily or always feel tired despite sleeping, definitely get checked for sleep apnea. It's a frequent driver of both nocturia and high blood pressure.
So if someone's noticing these kinds of changes, what should they track? What info helps the doctor?
Keep a simple log for about a week. Just note the time you go, roughly estimate the volume, note the color maybe on a scale from pale yellow to amber or darker, and mention if there was unusual urgency. Bringing that log to your appointment gives your doctor really valuable diagnostic clues.
And you mentioned color. Is there a specific color that's a major warning sign?
Yes. Never, ever ignore urine that looks dark like cola or tea. That can indicate blood, even if it's not bright red, and needs immediate medical evaluation. For general hydration, again, don't force down gallons. Aim for consistent sipping through the day. Your goal is generally pale yellow urine. And limiting fluids for maybe 2 or 3 hours before bed can often help reduce those nighttime bathroom trips.
Okay, perfect transition. Let's talk about the habits that actually move the needle on these kidney health markers. Let's start with food. What's the main focus?
The big goal with food is tackling that dangerous trio linked to faster kidney decline, high blood pressure, protein leaking in the urine, and overall heart disease risk. The most impactful strategy: lowering sodium intake. Really aim for somewhere between 1,500 and 2,000 milligrams per day. It sounds strict, but it's achievable. Build your meals around those patterns we mentioned, DHH or Mediterranean style. Lots of plants, beans, lentils, fish, olive oil, whole grains. Think whole, unprocessed foods.
And you flagged being careful about certain supplements or high-protein trends.
Absolutely. Be cautious with high-protein shakes or supplements. Some can be loaded with sodium or contain creatine. While creatine itself isn't necessarily harmful to healthy kidneys, it can affect lab tests, so discuss any supplement use with your doctor. Think simple, healthy meals, like oatmeal with berries for breakfast, a big lentil salad for lunch, maybe salmon with quinoa, and roasted vegetables for dinner. Keep it real, keep a lower sodium.
Okay, next habit, hydration. We talked about sipping steadily. You mentioned a calculation earlier, 30 to 35 milliliters per kilogram of body weight per day. Why that specific approach?
Your fluid needs are actually quite individual. That 30 to 35 milliliters per kilogram is a much better starting point for most adults. It helps ensure you're getting enough fluid for good filtration without overloading your system, which can happen if you just chug water randomly.
And how can people make that consistent sipping happen? Any practical tips?
The really easy way is to get a reusable water bottle, maybe 1 liter size, fill it up twice during the day, add a little natural flavor if those lemon slice, cucumber, mint. That can encourage you to keep sipping. The goal is just steady intake throughout the day to keep things flowing smoothly.
All right, movement. Let's detail that specific routine you mentioned for blood pressure and insulin sensitivity. It sounded structured but doable.
It is. The idea is consistency over intensity, necessarily. Aim for 5 days a week of about 25 minutes of brisk walking. You should feel your heart rate go up, maybe breathe a bit heavier, but still be able to hold a conversation. Then, on 2 other days, non-consecutive, add some simple strength training. You don't need a gym. Bodyweight exercises are great. Chair squats, push-ups against a wall, maybe using a backpack filled with books for rows. Aim for 2-3 sets of 8-12 repetitions. The intensity guide for strength is, you should feel the effort, like you could talk, but you probably couldn't sing a song while doing it.
And that universal quick win, the 10-minute walk after meals.
Seriously, if you do nothing else, do this. A short 10-minute walk immediately after eating has a remarkable effect. It helps blunt the blood sugar spike from your meal and gives your blood pressure a gentle nudge downwards. It's incredibly effective and easy to fit in.
Okay, great habits. But as we wrap up, it's important to stress that this isn't one size fits all. The best approach needs to be tailored based on individual risk factors, right?
Precisely. These general guidelines are excellent starting points. But if you have specific underlying conditions, your focus needs to be more targeted. For example, if you have diabetes, managing blood sugar is paramount. That means focusing on carbohydrate quality, really prioritizing those post-meal walks, keeping close tabs on your A1C, and definitely talk to your doctor about kidney protective medications if needed, like SGLT2 inhibitors or GLP-1 agonists if appropriate for you.
And what if someone's main issue is hypertension? What's their tailored focus?
If hypertension, it's doubling down on that sodium reduction. Relentless focus. Keep that accurate home blood pressure log. It's vital data for your doctor. And again, if you snore, wake up gasping, or have significant daytime fatigue despite sleeping, please get screened for sleep apnea. It's so often missed, and treating it can dramatically improve blood pressure control and reduce kidney strain.
What about athletes or people deliberately eating high protein, maybe using creatine? We touched on labs.
Right. If you're an athlete or using creatine supplements, understand that a study suggests creatine can artificially raise your serum creatinine level on a lab test. It doesn't usually mean your kidneys are being harmed, but it can look alarming. The key is having a baseline eGFR before starting supplements, monitoring it, and ensuring your overall protein intake isn't excessive long-term. Stick close to your actual needs rather than megadosing, which could potentially strain kidneys over time. Discuss it with your doctor.
Which loops us right back to that critical lab test you keep highlighting.
The ACR, the urine albumin to creatinine ratio. Please don't rely solely on creatinine or eGFR, especially if you're in a high-risk diabetes, hypertension, family history. The ACR catches that early damage, that protein leak, often years before the other numbers change dramatically. If you've noticed any of these 5 signs we discussed, even intermittently, ask specifically for the ACR test and bring your symptom log.
So the core message really boils down to consistency, doesn't it? Small, steady daily habits add up over time. Lowering sodium, sipping water steadily, moving your body daily, and tracking those key data points like BP and asking for that ACR test, that's proactive protection.
Exactly. So immediate actions you can take starting today. First, just audit your sodium for the next 24 hours. Read labels, see where it's hiding. You might be surprised. Second, plan maybe 5 home-cooked, lower sodium dinners for this week. Take control of the ingredients. Third, schedule 2 of those 10-minute walks after meals starting today. Fourth, if you don't have one, order a validated blood pressure cuff that fits you properly. And crucially, if any of those 5 silent signs resonated, if you've noticed one or more, even just a couple of times this past month, book that appointment, ask for the labs, including the ACR, and bring your notes.
Excellent actionable steps. And to leave everyone with a final thought to chew on, we often hear advice like, try to cook 80% of your meals at home. Think about the flip side. How much hidden risk may be in the form of excessive sodium, sugars, processed stuff are you potentially absorbing on those days you don't cook at home?
Taking back control of your kitchen really is one of the most powerful ways you can protect these vital silent filters. Stay curious, stay informed, take action. We'll catch you on the next deep dive.